Women going through menopause say there's a need for a much broader awareness campaign about the higher risk of falling into anxiety and depression when they start going through menopause, roughly in their 50s. It often leads to various issues, including anxiety, mood swings, and low energy. And there's a lot of questions around how to handle going through menopause as well. Also, menopause diagnosed, by the way, after a woman has gone through 12 months, a year if you will, without having a period. The South African Society of Psychiatrists is, of course, urging mental well-being. But how do we try and do that? How do we really actually get the help for those who may need it? Well, Dr. Joanna Taylor is a member of the South African Society of Psychiatrists, joining us now. Dr. Taylor, good morning to you. And it is such a big issue for women over the age of 50 or thereabouts beginning to go through this, and there isn't enough knowledge about, I want to call it the side effects, if you will. I may be using a completely inappropriate term, but the side effects of this. I mean, how bad can it get?
Morning, Gareth, and to the viewers. So it can become severe, you're correct. And one of the things that is a gap in the knowledge is that, in fact, brain-related complaints are among the top 5 complaints that women cite as the most troublesome during the menopause, and also during the perimenopause, which is the lead up to the menopause that can take about up to 10 years. And these include difficulty concentrating, insomnia, what they call brain fog, anxiety, depression, loss of interest, increased worry, many of these kinds of signs, which often are spoken about much less than the physical symptoms of the menopause.
And how do we try and fix that? How do we try and broaden the knowledge base of that to make sure that it's these other issues associated that get as much attention as often is the joke, the hot flushes, for example? How do we try and make it a bit more mainstream?
So I think talking about it, as you're doing, is helpful, and we're trying to get the word out there. I think also it's important for women to speak to each other, speak to their families about what they're going through, and to consult with their doctor if they're having troublesome symptoms, because there are many ways of managing these symptoms. Sometimes we do manage them medically, and that can be very helpful. And in fact, early medical intervention is much more useful and also much safer than treating these symptoms later. And it can have effects on quality of life, on longevity, and preventing other health complications down the line. But also there are many lifestyle interventions and other things you can do. And so it's important to talk about it as much as possible.
When does the symptoms become a concern? Because nearly every woman will go through this roughly at that age as well. But when do you think you should be consulting like a psychologist or a psychiatrist in this case? When does it go from just a medical change, a hormonal change, to something that requires perhaps psychiatric assistance? Where do we know? Where's that line for us?
So it is very difficult to find that line. But if it's affecting your functioning, which it really often does significantly, and we know that menopause in the workplace is a very topical conversation at the moment. So affecting your functioning and also causing you significant distress, those are the times when you should seek help for it. You can start with your local clinic, you can start with your GP, and you may end up wanting to see a psychologist or a psychiatrist, but there are many resources available other than specialized care too.
Just perhaps as I start saying goodbye to you, Doctor, are there certain personalities, even as a younger woman, that probably will lead to severe levels of anxiety and depression? If somebody, let's say in their early 30s, early 40s, is not quite going through menopause yet, but they're already anxious, they've got a family history of depression, maybe they've had postnatal depression, are there indicators for a woman watching now that probably they will end up with these severe symptoms, something early to look out for?
So one of the risk factors is not so much personality, but anyone who's been hormonally sensitive in terms of their mood and anxiety symptoms over the course of their life. Triggers like puberty, menstruation, pregnancy, and breastfeeding. If someone has had mood and anxiety changes during those periods, then they will be more vulnerable during the menopause.
Doctor, I'm going to say thank you very, very much, and I'm going to ask everyone who wants more information of this. I'm sure you can go and Google, of course, Dr. Joanna Taylor, also to Google the South African Society Society of Psychiatrists. But yeah, the research is there, the help is there. Dr. Taylor, thank you very much for your time this morning.